Hey, sports pharmacist, it's Ashley with the International Sports Pharmacist Network. I have Claire May with us today, and she's going to talk about her role in sports pharmacy. Welcome, Claire.
Hi, Ashley. Thank you for inviting me today.
Yeah, thank you. I appreciate your time. If you wouldn't mind, give us a little idea of what you're currently doing in your current practice.
Well, here in the UK, which is where I'm based, just down in the southeast of England, I'm what might be referred to as a bit of a portfolio pharmacist. So my main day-to-day job is working at the University of Sussex, where I teach undergraduate students on the MPharm. That's our pharmacy degree here in the UK. But I also still work in practice. So I do 5 hours a week in community pharmacy, where I'm working with face to face with patients, delivering services like dispensing, flu vaccination, that kind of thing. And I also provide some consultancy work to the PGA European Tour. So I have a few strings to my bow, which is great.
Yeah, that's wonderful. Yeah, and I find a lot of times people who are working in sports pharmacy do keep that diversity in their career, and I love it. I do it as well. So tell us a little bit about the path that led you into sports pharmacy. How did you get involved in what you do?
Well, for me, pharmacy has opened so many doors. I just think, like, from when I started my degree, which would have been in the late 90s, and graduating in the early noughties, I just looked for lots of different opportunities, and I would look to see what was slightly different. So I was a pharmacist at a music festival called Glastonbury, which is held here in the UK, and I loved it. I loved the diversity that it brought because you were meeting such different people. And I thought, well, what else could I do? And I seen an opportunity to volunteer for the London 2012 Olympics, and I threw my hat into the ring, and I was lucky enough to be one of the I think it was a group of 1,000 pharmacists that were interviewed. I think it might have been about 250 pharmacists were chosen, and I actually got to work in the polyclinic in the athletes village. And that experience was just phenomenal. In fact, decided to stay and made sure that I worked the Paralympics as well, because that was just another level of providing pharmacy services. When I got the opportunity to work in the Olympics, I realized the benefits that a pharmacist could bring to athletes and the wider athlete family, actually, because of course when an athlete travels, they travel with not just themselves but their family or their entourage. So we were able to provide minor ailment services, advice, and a lot of the time it's signposting and talking people through their medicines to optimize their treatment. From there, I then managed to get the opportunity to work with the PGA Tour. And working with them, it was just another kind of focus around a single sport, so golf. And I worked with the mainly the physios, because they had a physio team, and the medics, around just trying to look at what could we do that would really help them again optimize their care. So if they were coming in with maybe hay fever or aches and pains, what could we do there and then to keep them on the course, to keep them playing, to keep them competing? So it's really just developed from there, and I've been lucky enough to meet people like yourself, and other sports pharmacists, who have encouraged me to look at other ways of learning. And so I've gone on and done the IOC certificate for drugs in sport, and again, just lots of different avenues. So I'm this eternal student. I never stop learning. So
Yeah.
it's one of the key things I think you need to do as a pharmacist: keep on learning, lifelong learning.
Right. Yeah. It wouldn't be hard to get stuck in a certain pattern as a pharmacist and just do that day-to-day job. But just as you've described, you looked for opportunities and they exist. And as you and I have talked about earlier, you need to have that pioneering spirit. You need to see what opportunities might be there and then kind of create your own path. And I love that. That's what I really enjoy about doing these interviews with sports pharmacists, is that your path into this is unique, but each person has really put their own effort forward to kind of create the name for themselves and create a job for themselves. And it's just
I
fascinating.
Yeah, I think that's true. I speak to the undergraduate students and I say to them, what interests you? What lights your fire? What makes you excited and want to get out of bed in the morning? Um, and to be honest, I think if we're canny enough, if we search hard enough, there's probably a role for a pharmacist near enough any passion that a student might have. So I had one student who talked about, gaming, and I mean like on their Xbox. And actually, those gamers need to have a good physical and mental health. And
Yeah.
so they'll need potentially, pharmacy support. So I think there's always an angle, and that's where I come from.
Yep, yep, I love it. I just had that same thing come up with my pharmacy student as well about esports and what are the anti-doping rules for them. Because obviously they're not going to worry about something that increases their strength, but obviously the mental performance and the stimulants would be
Yeah.
a higher risk for them to potentially use. And how would the pharmacist fit into that role? So yeah, I love it. I agree with you. Find what you're most interested in. And, for us that work in sports pharmacy, there's so many different aspects, even within this niche. And it's
Yeah.
wonderful. I really enjoy it. So, and then lastly, you mind telling me what you think would be the future of sports pharmacy?
Well, I think it's interesting from my perspective, pre-pandemic, so pre-COVID-19, maybe the perception of the pharmacist, certainly in the UK, felt very much like we were maybe a logistics, a supply function with a few additional benefits of advice and maybe education. But I think during COVID-19, certainly within the UK, the public seen that pharmacists have a lot more to deliver. We can actually really respond to those minor ailments. We can really respond to those queries there and then when they crop up. So I think we can harness that really good public perception and run that through into sports pharmacy and think about, with the athletes, and think about, again, it's not just the athletes, but the athletes' family, whether that be their coaches or people who are supporting them, and showing that we can, provide them with the information that they need in a succinct, easy to understand manner, so that they are not falling foul of the anti-doping rules, so that they are keeping up to date. And one thing I've noticed, and I'm sure you have as well, things are forever evolving. So whatever we've learned now, and whether we learn that in a postgraduate environment or just on our own in our own bedrooms or wherever we are, or at undergraduate, it's forever changing. So actually, we need to be there. We need to be at the forefront of what's changing and be able to communicate those messages so that people can really understand it. So I think the future is bright. I think we've got a lot to offer. And I think if we really focus on what it is that we can deliver and make it clear to the athletes and the wider team, then we've got lots to get and gain from it.
Yeah, very well said. Yeah, I really appreciate that. I mean, so, in school, I'm sure it's the same in the UK, you spend so much time in school practicing how to communicate big pharmacy ideas into terms that that individual patient will understand. And I really agree with you that putting it in meaningful terms for the individual is really the spot where pharmacists can shine when it comes to talking about medications and health with athletes and self-treatment. So,
Definitely,
yeah.
definitely. And we work between, you know, our physicians, the patient, and even pharma companies being able to, I suppose, interpret and relay what they mean by some of what can feel quite alien sometimes in the way in which it's written, that we can really assimilate that information and provide hopefully the good advice that everyone needs at a level that's right for them. And I think that's what a pharmacist is good at, understanding where the level is. And sometimes they may pitch it too high, but hopefully if they've got that good basis of communication, then they'll be able to see that and they can rectify it, because, you know, we don't want to go into too low level or too high level. It is about getting the information just in the right context to the right people.
Yes, yes. Yeah, and people do like their information in real digestible doses too. And, you know, just with you working in the community pharmacy setting, seeing those same patients over and over and over gives us that opportunity to feed them those small pieces over time and build up that trust.
Yeah, and I think we need to get pharmacists to realize that those customers or patients or clients, whatever your service will call the people that you're interacting with, they could be an amateur athlete that could go on to become an elite athlete. And of course, what we do doesn't have to be all around elite athletes. It can be amateur. So it could be going down to your local events where people are playing football, or it could be where they're going to run and do marathons, you know. So it's not just about elite sport, it's about all sport.
Yes. Yeah. Yep. I love that point, and I fully support it as well. I mean, even though there are those of us who work with the elite athletes, there's so much that it takes to get them there. And, you know, it's not a sprint for us, it's a marathon. So,
Yeah.
yeah, I do agree fully with starting in the local communities and having pharmacists integrate their knowledge into the younger athletes and using the tools that already exist with the anti-doping programs, or, you know, sports medicine programs that are already available and established locally, and showing how our value fits into that. So
Yeah, definitely.
wonderful. Well, thank you so much. I'm sure we could go on. We have so many things we could
I know.
potentially talk about, but we'll just leave it here for today. And thank you so much for joining me. Anybody who's watching this video, please like it and subscribe to the channel. Share with anyone else who you might think benefit. Thank you very much.
Thank you.